The examination is the cornerstone of the veterinarian client-patient relationship. Our patient may not talk, but they can speak to us through a well-performed exam. When done properly, the examination transforms information into insight and builds trust between the veterinarian and owner or trainer.
If we think of the examination solely as a clinical tool, however, we miss the opportunity to create stronger relationships with our clients. Our clients value how we treat them just as much as they value our medical treatment of their horses.
Every veterinary school graduate knows how to perform a clinical examination. What you may not know is how to perform a client-focused examination.
I'm going to share the techniques I've learned over my years in practice, which help show concern and compassion for my clients as well as their animals while delivering the medical care their horses need. My preparation for an examination actually begins before I pull into the client's driveway. And while my technician drives, I review the client's record on my iPad. Before I get out of my truck, I have chosen a comment or question to ask the owner specific to the horse based on my last examination. I always address the owner by name and make sure I know the horse's name and use it in conversation with the owner. Hello, Joel. Hello, Joel. My technician leads and holds the horse during the examination. There are three important reasons for this. First, safety for both the owner and myself. She looks very good. Secondly, my technician knows my routine and helps to make the examination efficient. And finally, I can communicate with the owner better because the owner is not distracted by handling the horse. The owner is focused on what I am explaining. Stroking and maintaining contact with the horse throughout the examination demonstrates to the owner your compassion and also creates a sense of trust between you and the horse, which allows you to have a more cooperative patient. I think you're okay on this hoof. During the examination, I'm constantly sharing my findings with the owners. Owners are as interested in hearing that everything is normal as they are when I find something that needs additional attention. The only time I'm not talking to the owner is when I'm using my stethoscope. You want the client to always see and hear what you are doing. Okay, I think we're all set. When the examination is complete, I ask the owner several questions, such as, what are your plans for the horse over the next 3 to 6 months? Or do you have any special concerns that you want to discuss? We always set expectations for the next visit, whether it is a re-examination for a problem or simply the next wellness examination. When I get back in my truck, and as my technician is driving us to the next call, I download the photos of the horse from my iPad and also complete my electronic physical exam form. The photos in the exam form are placed into a Dropbox folder so my office staff can access the files and create the reports. Within 1 to 2 days of my examination, the client receives via email the wellness report that I created about their horse. Good to see you again, Dave. It strengthens their satisfaction with my services, and it is another reminder that they are important to me. We'll see you next time. As legendary educator and esteemed horse doctor Tom Vaughan said, there is no substitute for personal attention and sincere concern. When you perform a client-focused examination, trust is earned, and veterinarian and client are transformed from two strangers into partners working together on behalf of the horse.